All right, welcome to another episode of Medicine Mondays. Yours truly, Dr. Barry Pierre. Sexual Health Awareness Month, depending on when you're listening to this episode. I will say it's a first, especially for the Lunch and Learn community. Not that we don't always talk about the men, but a lot of times we don't really talk about the nitty gritty and stuff that I think is extremely important, which is sexual health, sexual importance. And I got an expert here that I think you guys are going to be very excited to hear from, Dr. Pash. Thank you for joining the Lunch and Learn community, Medicine Mondays. How are you doing, first and foremost?
Good. Thanks for having me. Doing great.
I'm going to have your bio in the show notes. I want to just kind of give a quick little opening, say, all right, who's Dr. Pash? Tell us what you're about, and then we'll start really getting into your business as far as what you do and really the benefits, especially for my men during a month like this, like sexual health awareness.
All right. Well, by training, I'm an anesthesiologist. So, I do lots of injections in my anesthesia practice. I started this business called Upsize Clinic about 3 years ago. So now that's expanded to 12, 13, 14 practices. And so it's a fairly large company now, and I'm the CEO of that company. So I do medicine part-time. I should say anesthesia part-time. I do penile enlargement part-time, and I do running a company part-time. In my spare time, I have a 5-year-old. I play music, I do tennis and things like that, but a lot of effort running this company right now.
And my Lunch and Learn community is very familiar because they know I have affinity for docs who say, you know what, I don't want to only do the doctor thing. I understand that there are multiple hats that I should be wearing. And, the hat of a CEO, right, obviously, definitely one I'm very excited to talk to you about. And I know my Lunch and Learn community is going to ask, how do we go from anesthesia to doing penile enlargement? How does that path take us?
Well, in my case, the first step was knowing that you wanted to do something else, right? I mean, I guess a lot of doctors because I still work in the hospital in the operating room, a lot of doctors are kind of set on the fact that they're a doctor, that's what they trained how to do, and that's what they have to do, right? So the thought of moving out of that never even crosses their mind. Or if it does cross their mind, it's like, well, that's impossible. I'm a surgeon. That's what I have to do. In fact, I have surgeons that have said to me, how could you take all this time that you did your training and all this and waste it on doing penile enlargements, right? And it's like they're seeing a very narrow view of what is possible to do as a doctor. There's, as you probably know, doctors that run pharmaceutical companies or do consulting or do, tech companies. There's doctors that are lawyers, right? I mean, anything. We have basically a 4-year graduate degree, and lawyers have a 4-year graduate degree. So you learn a lot of things there besides for just biochemistry and anatomy. In my case, I have a business degree also. And some, other experience in business.
Were you already kind of doing that within your medical degree, or was that something that I think I could probably use this business degree on the back end, or was that kind of just intentional?
Yeah, I mean, to be clear, I don't think you need any degree to run a business, right? You don't need a business degree to run a business. I think it is a skill. I mean, it's a skill that I always had. I had this skill when I was in high school and undergraduate university. But my background is I ran a business in high school. I was actually a concert promoter, booked bands. And basically when I was 17, 18, 19, 20 in college, I was a concert promoter at my college. So I went into business school well before I did medicine, and I did management consulting. I did that for 3 years and I quit that job to go into medical school. So at that point, I thought I was just pure doctor. I had no intention at that point of doing anything except medicine and anesthesia. But I think the background was still there, right? I've always had a drive to do business, even when I was in medicine. And this penile enlargement thing kind of, I was looking for something to do, but I didn't know what it was. And this thing just kind of landed on my lap, unexpected. I never would have thought I would be doing penile enlargements, right? At any point in my business career or medical career, this was very low on the list of probable things that I would be doing.
What were your thoughts prior to going into the business of penile enlargement? Were there any preconceived notions or thoughts you had in regards to the business of penile enlargement? Or you were just, hey, I'm open and something's happening in front of me?
I had never heard of it. I didn't know it was a thing. I literally knew nothing about it. And one day I had a marketing guy I was talking to that told me about this doctor that he did Google marketing for that was doing this. And I kind of was like, that's interesting. And I didn't personally want to go. I did a couple of Google searches and then you just see a bunch of penises, and that didn't really interest me. So I had my wife actually look into it. I said, why don't you look into this and let me know, if it looks legitimate or whatever. And she came back to me later on and said, yeah, I did some research and it looks real, like it actually works. So that's really how I got into this. People have asked me, were you looking for a penile enlargement? And then that's how you found out about it? Or did some other doctor tell you about it? So it was none of those things. It was just kind of a random
marketer that says, hey, what about?
Yeah.
And then, so it's interesting how fate can kind of point us in different directions, even when we're not looking for it. And what tends to happen, you kind of say with your colleagues, because I kind of do it with my colleagues as well. A lot of times we're so closed-minded that even if that marketer would have said something to us, we would have just brushed it off, wouldn't have paid it any mind. We wouldn't have told our wife, hey, look, we would have just completely shoo-shooed any thought of that because we would have been so siloed into I'm an internist, I'm an anesthesiologist, I'm a whatever the thing is. So even having that mindset that you're like, I'll take a look at it. Because It doesn't even hurt to take a look at it is such a big step in that direction. When you get to the point where you do the research, it looks legit, and you say, you know what, I'm about to start this clinic. How did that go about? And more importantly, especially when you're taking care of the first patient, because now I'm going to probably ask questions as if I'm patient, because obviously you're still working, right? I'm assuming, right? Yeah. You're still anesthesiologist, you're starting to make this transition. And the reason why I ask this, because I know a lot of my physician colleagues, when they are making the transition, kind of that 1 foot in and 1 foot out, but I hate to say out because it always seems like we're leaving medicine, but into a new situation that sometimes is difficult for them to kind of process.
Yeah. So, I was lucky in a few different ways. At the time I was working at the VA for the federal government. So it was possible for me to kind of transition to part-time. As a government job, you can do that. And most times, if you're in a private practice group, now I'm in a private anesthesia group, but most groups, if you said, yeah, I only want to work 2 days a week, they would just kind of say, well, we don't need you 2 days a week, right?
We need you. Get on.
Right. But the VA, they need you full time too, but you're at the VA, you're kind of equivalent, you're the same as a cafeteria worker or a US Postal Service worker. You're a federal employee. If you want to work part time, they kind of have to let you work part time. So I was in a situation there where I could cut back a little bit. I have a colleague and now a business partner of mine who I knew from a while back because actually I'd grown up with his brother and he is a cosmetic surgeon in Sacramento where I live. So that was useful because I was able to use his office. He had a full functioning office and staff and all that. And so obviously a big milestone for starting a business is you need an office and you need staff and all that stuff. And that could be pretty daunting if you've never had a patient before. That's a good way to lose money, right? Is just start an office and not know how you're going to use it. So anyways, so I had an office to use, and actually his name's Jack Friedlander. Like I said, he's a cosmetic surgeon and he's my business partner now. He's a part owner in the company as well. Nice. At the time, basically we started a new medical practice. We started advertising and trying to find patients.
How was that initial? Because I always talk about, especially from an internist perspective, many of the reasons why the men, right, will come to see me in the office. One family member says, hey, you haven't been to the doctor in years, go see the doctor. Or there's some type of sexual dysfunction, ED, something in that realm that makes them come to see me. And even when that occurs, they come to see me for a fluff reason. My back hurts a little bit. And then right when I'm about to leave the room, it's, oh, hey, doc, by the way, it's those questions. So the type of patient that, you're looking for, the type of patient that you see, is that apprehension still there, or have they kind of gotten over that hump by the time they say, all right, I need to come see you?
Yeah, I think most of them have gotten over that by the time they need to come see us. There's a lot of, in most cases, not in all cases, but in most cases, there's a lot of research that goes into this before they decide to come see us. So it's because it's not a well-known thing yet, for example, breast implants are, for example, most guys, like an initial web search might be like how to enlarge your penis or something like that. So they have no idea if it's possible, if they're looking for a pill, a pump, a procedure, a surgery. So that's like a whole pathway that they go down trying to do research and all that. And really the ones that come to our office usually have done, enough research that they know what it is and they're over it. Of course, there's exceptions. And we have people that come in and they have no idea why they're there. They just like called the website and
then they're here.
Showed up. Yeah.
When you talk to them, what are some of the potential risks, right? Because I'm pretty sure that's probably a big, like, what is potential risk that they say, hey, doc, all right, what do I have to worry about? Like, if I go down this path here in regards to penile enlargement, what are some of the things that you always have to caution your patients about going down this path?
Yeah. So obviously you need to give people all the reasonable risks, like the risks that a reasonable person would want to know, just like in any medical procedure. So I tell them it's an injectable procedure. There, anytime you have a needle in anything, there's a possibility of infections, which are rare, but possible damage to structures like blood vessels, nerves, the urethra, the corpus cavernosum. And with anything cosmetic, there's risk of imperfection or not being happy with the procedure or it not lasting as long as you want or things like that. Now, all those things that I listed are incredibly rare. In my time doing this, so like in 3 years, I'm probably doing 600 or 700 procedures. I've seen 2 infections, which were mild, and that's it.
Amazing.
Yeah, obviously you have a few people that are like, not happy and you can usually fix things and all that, but no real complications per se.
And now to talk on the good side, obviously this is why they come to see you, right? They say, right. Doc, like I'm coming to see you. What are some of the benefits? Like what can I expect, right? The reason why I ask is I wonder if sometimes you almost have to temper their expectations of what they can get from going in and getting penile enlargement.
Yeah, totally. So as you can imagine, the guys that are looking for this oftentimes want the biggest, most ridiculous thing possible. And there's a few issues, like number one, so now we're doctors talking, like you probably have a pretty good grasp on what an inch is and what like the difference between circumference and diameter and all that is. But, a lot of people will get messages saying, yeah, doctor, I just want to add like, 7 or 8 inches onto my dick or something like that. And, it's like, do you, in total seriousness, and of course there's many like issues with that statement, but number one, usually they're asking for length and you can't really add length onto a penis. Number two, obviously adding 7 inches onto anything is not possible. So, it's those kind of things. But in reality, the way our business is structured is we have guys that answer the phones and emails and text messages and all that, and kind of screen those people out and do kind of not consultations because they're not doctors, but just discussions with the prospective patients, kind of letting them know what we can do and what we can't do and all that. So for the most part, by the time I see them, they're like fairly educated, but not always. Sometimes read the phone transcripts and the emails and text messages and stuff. So I do know like what the average expectation, the average request is, which is not obviously like what we actually do, because you might get 100 inquiries before you book like 2 patients. So, what the average person wants is not what we can give them, but what the average person that shows up in our office is like, we can give them what they want.
And kind of going in that same path, when people hear penile enlargement, I think there's still that mystery for a lot of patients of like what that even actually entails, right? Is this surgery? Is this pills? And I'm assuming like in the pre-process, you're kind of, educating the patient, but a person who may not like be even aware that penile enlargement is a thing. And now they're trying to figure out like, what are the different ways we can do it? Like, what are some of the things that, especially in your clinic, that you guys offer as far as different options, penile enlargement? I'm not sure if I'm saying it correctly, but
I think you're saying it correctly. So the main thing that we offer is dermal filler. So that's an injectable procedure. It's the same filler that's used in lips, mostly that women get. It's injected. It's all done like under sterile technique and with like an aesthetic microcannula. So a microcannula, for the listeners that aren't familiar, is kind of like a dull needle. So it's difficult for it to puncture through things that it's not supposed to puncture through because it's not a cutting sharp needle. Anyway, so it's done with that. And just because of the nature of the penis, the anatomy and the physiology and all that, you can imagine it's really only possible to make it thicker. Like you can surround it with material, which is what we're doing. But you can't like add material onto the end of the penis and make it longer.
Is that a question that you typically have to answer for a lot of your potential patients? Like length is, a whole separate process versus like width and diameter.
Yeah. And as doctors, it's probably a lot easier to understand. Like if you wanted to make a penis longer, you would have to cut it in half. You'd have to like graft on urethra, corpus cavernosum, like nerves, arteries, veins, skin, right? And then like somehow sew it back together. That's basically the reality of it. But for a lay person, they don't really necessarily, they can't wrap their head around that. It's like, oh yeah, just put something in and make it longer. So that's impossible. But of course you can put material around it and make it thicker. And so that's a very common thing that we need to explain to people. And like my phone guy tells me, like, if I could make a penis longer, I'd be a billionaire, right? But I can't. So
now, is this something that is done? Because I know a lot of patients will typically ask, all right, do I have to go to like an operating room to do this? Am I under anesthesia, like sleep? Or is this something that's done right in the clinic offices?
Yeah, it's just done in a procedure room. Like it's not an operating room. It's not just a doctor's office room. It's something in between. Like it's a clean room. It's got a procedure table on it. We usually have a surgical assistant, even though it's not a surgery, and passing us tools and syringes and needles and stuff like that. But yeah,
the reason why I ask it, because I know a lot of times, people, if they feel like, oh my God, I got to get some type of surgery, right? Like a lot of time that scares, people like, oh, if I got to do this whole surgery. But I think if they realize like, oh, I'm in the same building. It's, I'm not having to, be under lights and sleep. I think it makes it a little bit easier, especially when you start talking about injecting the penis, right? Now, again, obviously, I think your patients are probably kind of on that stage. I could just imagine if I was doing primary care medicine and having to try to like transition a person to like see you, right? And they're like, they got to inject what? Like, I'm just thinking of that picture, and that tends to scare people from that perspective.
Yeah. So like you could get this done on your lunch break, and we have people that do that. They just come in, it takes an hour and they go back to work.
Interesting.
A needle in your penis is daunting for sure, but the needle that you feel is the numbing, and the numbing works quite well. So, once that numbing's in, they feel a little bit of pain, and then that's it. They really don't feel anything else. And most patients, if they do come in nervous, leave like literally saying, that was way better than I thought it was going to be.
I love that.
Yeah, I think when you go to the dentist, for example, like most people, the experience with numbing is the dentist, right? Numbing never really works out well. The dentist is basically doing like a blind nerve block where they're trying to get local anesthesia around some plexus of nerves. And there's varying degrees as to how good they are at that end. Like people's anatomy is different and stuff. And in general, nerve blocks like don't always work even in anesthesia. But in this case, we're doing just basically like local anesthesia. Like we're just numbing the skin, and it's pretty much 100% effective. So once that numbing goes in, you're just completely no sensation, which I think is different than the dentist.
You kind of mentioned that sometimes people can do this on their lunch break. And that already leads me to the question, what are your like post-procedural rules for your patients that, they have to typically follow, and, things they have to avoid in regards to like having a procedure like this, especially the injectable kind?
There's not much. We tell them not to have sex for a week, purely just to prevent infection. As you know, if you tell someone don't have sex for a week, they'll have sex in like 3 days. And so if you tell them like 3 days, they'll do it in 6 hours or whatever. So we just say a week, and probably most people don't listen to that. But that's the thing. We just want to keep the area clean. Because it's injectable and these are like 25 gauge needles, usually those holes are quite small, and in reality, they're healed within a day or so. But, we're just extra safe and tell people to take it easy. But it's not like painful afterwards. That people don't have to sit at home and do nothing, and they don't have to take pain medications or anything. So you're pretty much like good to go, right?
How much, especially because we already know how patient behavior is, how important is the patient education prior to the procedure or post-procedure? Like, do you find that like if we spend a good enough time, like before everything happens, like our end results do much better? Or do you still find yourself having to educate and say, hey, this is what's going on. These are risk factors. Again, avoid sex for 3 days, like a week, please. Where do you find you tend to get the most bang for your buck as far as patient education is concerned?
I think it's probably like the main bang for your buck is expectations, which is what we're doing beforehand. Because as long as people understand what it is that they're going to get, they're almost 100% happy. But if you just rush into it and, like say the guy doesn't speak English that well, and not that I rush into it, but, this has happened, like someone doesn't speak English well and you explain it to them, but maybe they don't totally understand you. And then you do the thing and they're thicker, but that's not really what they wanted. So those are the guys that aren't going to be fully happy. Now, we always make people happy anyways, but to answer your question, it's the beforehand. Now, the procedure takes about an hour. So during that time, a lot of times I'm talking to them about, what to do afterwards, or sometimes you can even kind of show them what it's looking like as you're going if they want to see. Now, the other thing is when we started doing this, we had a lot more instructions that we would give people. And just as we got better at it and more experience, we kind of realized what is necessary to tell people and what isn't. And so now it's actually fairly minimal. Pretty much.
Did you feel like you were giving them too much information and that they would kind of get overloaded from it, or were it even it wasn't even registering because it was so much?
All the above. It's like any medical procedure. You just get better at it the more you do. And there's some planes and some kind of tissue planes in there that are not necessarily obvious. So when we started, we would kind of inject in a certain area, and sometimes you get it right and sometimes wrong. And if you get it wrong, it's not like dangerous or anything, but the filler could migrate a little bit. And so we expected that. And so we would have to tell patients, okay, if the filler moves, you need to mold it or push on it a certain way. And because of that, we'd have to wrap it and have instructions on how to put the wrap on and wrap off and stuff. And so now that we're just better at it and more precise, it's just like we just inject it and send them home, and 99% of the time they don't have to do anything.
As you were saying that, a question popped in my head, and I'm pretty sure someone in the lunch and learn community is going to have it. The men who are coming into it now, do they have to be erect? Does the filler make them erect? How does that work, in the procedure?
Yeah, some doctors will do it erect. I don't. And the reason I don't is because it just shrinks. The erection goes away as soon as they leave. So, you can make the argument you want to see what it looks like erect, but you can also make the argument, it might look great erect, but what's going to happen when they leave the office an hour later? And the other problem is to get an erection, you have to usually get trimix, and that can cause priapism. So that's just one more thing that's going to make me not sleep well at night. So I'd rather just not.
If you could explain to the listener community what priapism is, I'm pretty sure they've heard, especially if they've heard about Viagra. But
yeah, so priapism is when you have an erection that doesn't go away, essentially, and it becomes a medical emergency after, I think it's an hour or two. So the risks of that are basically using Viagra, Cialis, those kind of things, and trimix. And there's antidotes to trimix. So the antidote is phenylephrine, and most people that get trimix have that antidote on them. And with Cialis, you wouldn't have that on you because you're not used to injecting the penis with things. But for all the listeners, you should definitely go to the emergency room if you have an erection that doesn't go away. Otherwise, you can lose your penis, basically. So that losing a penis is bad. I think we can all agree on that.
Remember Lunch and Learn Community Sexual Health Awareness Month. Losing your penis is bad.
Exactly.
If you don't get nothing from our show today, that should be the byline. It just popped in my head. How are the partners in these situations? Are they coming to the appointments as well? Is this usually a solo mission for the men?
I've seen all kinds of crazy stuff. I've had wives come, had girlfriends come, boyfriends come. I've had someone come with their mom. I had a grown adult brought his mom, and a grown adult brought his dad. I've had kids waiting in the lobby, just anything you can imagine. Now, if it's me personally, I would probably come alone. And normally 9 out of 10 people come alone, but there's still 1 out of 10 that have some sort of crazy thing.
Okay. All right. That's okay. That's good. That's good to know. Good to know.
It's we had this, he was a 19-year-old, and his mom came with him, and I thought it was totally crazy. But, when you actually think about why.
19?
Yeah. So now this kid was 19 and I actually ID'd him because I was like, you brought your mom. I better make sure you're actually like over 18, which is our age cutoff. And I talked to his mom and she just said, like my boy's going to see a penis doctor. I want to vet the guy and make sure that he's legit because she didn't trust her son to like vet the doctor properly. So in retrospect, that's actually a pretty good reason for the mom to come, but you still you're not used to seeing people's mom in the dick enlargement office. So.
Now, question. That's a tangent I didn't even think I'd have to even go down. Because I just assumed, right? And again, this is just probably me being the naive internist. I just assumed that this was like an older population of men. Like I thought it was just all old men. Is that like incorrect to assume?
That's incorrect. Our average age is probably 30 to 45.
30. Wow. Okay. See, once you're in the community, this is why you ask the questions.
Yeah. I mean, remember, we're not doing ED necessarily, right? So we're just making it bigger. So basically, if you're the type of guy that wants a bigger penis, you probably want it when you're 18 and when you're 65, right? But the guys that have the disposable income, time and all that are usually like over the age of 30. And then I think after you get like above 60, obviously 60-year-olds still have sex and they still care. But I think most of them, they're good by then, right? I mean, if you made it to 60 with the penis that you have, you're probably cool with what you have. A lot of them are, if you're 60, you might have health problems, for example, that make it low on your list of priorities to get this done, or you might be like in retirement age and don't want to spend $8,000 or whatever, right? So kind of like the sweet spot is 30 to 45. It's guys at the kind of peak of their income earning as well as at the peak of sex and
like sexual
having
activity
fun and all those things.
And right now you said you have how many clinics now?
So Upsize has like 14 or so. Now, I don't own them all. I own 3 of them and actually work at 3 of them. And the other ones are kind of franchisees of mine. So they're independent physicians. And for your listeners that are physicians, we'll give you the contact information at the end because all of these other doctors are doctors themselves that wanted to get into some other type of business or medicine. So we actually have 0 urologists that work with us.
Interesting.
But we have dermatologists, surgeons, ER doctors, anesthesiologists. We have a plastic surgeon now. So, we have 2 interventional radiologists. Now, we try to find doctors with specialties that have the skill to do what you need to do, right? Like certain doctors have a lot of skills doing procedures. And at that point, it doesn't really matter if you're a surgeon or a urologist or an anesthesiologist, like injecting a thing.
Right. Yeah. As long as you have the dexterity to do the thing.
Right. Exactly. So maybe a psychiatrist wouldn't be the right person to hire. We love psychiatrists, but I don't see them using needles and stuff like that.
And so during this time where you're seeing this growth, and like I said, especially because now you're kind of in the field, like has there been like significant advances and changes or things you're like, wow, like when I first started, we used to do it this way, but now like we do it like totally different, or has that process kind of remained the same throughout your training? Or just
I was alluding to earlier, we have kind of learned new techniques on how to do this. Basically, we inject the filler in between 2 fascial, or we started injecting the filler in between 2 fascial layers, which is dartos fascia and buccal fascia. Those are 2 layers in the penis. And as we got more skilled and more advanced at it, we actually had some doctors that had ultrasound machines and kind of noticed like, when I do it, sometimes it works better than when I do it other times. We were actually able to look at the planes using an ultrasound machine and realize that what we think the layers are is not actually what they are. So sometimes like the textbook is not exact, right? And everyone's anatomy is a little different.
Do you have to do ultrasound guided like injections?
No, the ultrasound was mostly used to identify some of these layers. Like you have the dermis, the subdermis, the subcutaneous, the fascia, the area in between the fascia, another fascia. And then so you have all these layers. And when you're doing an injection, sometimes you don't know what layer you're in. For example, if you're giving someone TB test, they tell you to go subdermal. right? But, maybe you're subcutaneous, maybe you're
Mm.
intradermal, maybe you're like whatever, right?
Right.
There's so many places you could be. And so that's kind of where I'm going with that. Like we just kind of got better at that and kind of realized that the layer that we originally thought we should be in is not where we should be. Now, the procedure works either way. It's just that it works better if you do it, if you have some subtle differences in where you're injecting it. So there's that from an actual technique perspective, but then there's the fact that it's somewhat getting more popular. And so I think we're kind of alluding to that, right? It's like more people are looking to have it done. And so it requires, in a way, like a certain, maybe like a different type of advertising and different type of awareness that we have to focus on. Because at first you're just like trying to advertise, make your penis bigger, right? But now you can kind of advertise penile filler because people kind of know that that's a thing, whereas they didn't used to know that.
Yeah, because I would figure that would be a terminology that wouldn't, especially for the lay person, that wouldn't even like pop in my head. Because you kind of mentioned a lip filler, right? And I definitely want to ask that follow-up question. But now, if you hear penis filler, penile filler, you're like, oh, okay, I could see like that same inference of what they're kind of referencing. Now, when I hear about lip filler, like I sometimes hear that they typically have to go back and do it again every 3-5 years or some type of time frame. Does this procedure have that same type of, I guess, follow up in regards to like, hey, like if you do it now, you're gonna have to do it again in 3 to 5 or
yeah, so it's not permanent. Yeah, so there different types of fillers will have different properties that last like varying amounts of time. We use hyaluronic acid fillers, which that's like the most modern type of filler, and that's what's used in the face usually. The reason we use that is because it's reversible with an enzyme. So some of the older, less kind of common fillers last longer, but they're not reversible in case of an issue. So I guess long story short, our procedure lasts an average of 2 years. There are fillers that would last 5 years and there's fillers that'll last 3 months. But we kind of decided that the safest way to do it is kind of those 2-year hyaluronic acid fillers. So yeah.
So let's learn community members. Obviously, if you're finding something reputable, and we're gonna ask Dr. Pash to make sure, like, how can you kind of dignify whether a person is good or not? Just have that idea that yes, this is a procedure. It works great. Safe, but you are going to have to do it again, right? So don't think this is a one-stop shop and you never like see us. Like you're going to have to do this again, and you're going to want to do it again. Just like when our ladies get their lips done, right? They know they have to do it again. Just coming with that mindset that like, oh yeah, this is something that I'm going to have to do again, especially if I want to make sure this lasts as long as possible.
Yeah, exactly. It's not cheap, right? So that could be a little bit daunting when we see people who say, oh, it's $8,000 and I got to repeat it in 2 years. And unfortunately, yeah, you do. Like I said, there's permanent procedures, but they're not really permanent. And so like if you were to get a permanent filler, it's still going to wear off, but it might not wear off evenly. And then we see people with like lumps and bumps and it kind of looks funny. And then, so that's kind of the downside of that. Going back to repeating it every few years, it does have to be something that is kind of within your budget and that you can afford to do. But of those people that can, most of them get it done again. And actually, a lot of times people will come back before it wears off and just get it bigger because they like it so much that they just think, well, let's add another 20% or something.
Okay, nice. And I'm assuming because of the type of procedure it is obviously it's a cash-based procedure. Yeah. The Aetnas of the world's not covering something like this.
Correct. We don't want them to. It'll be a rainy day before they do. So.
Yes. Oh, I love it. I love it. So first of all, I want to thank you for taking the time to educate our community, educate myself as well, too. Like I said, I tell the lecture learning community all the time, I'm an internist, but I be learning just as much from my guests as you guys learn from them. Now, as far as those like docs who are out here, right? I have doctors who listen to this show as well, too, who like may even be interested, right? How can they get in touch with you, follow up with you? What are websites? Now, remember, Lunch Learning Community, all this will be in the show notes. But I always like to, get my guests some time to kind of like promote themselves, right? Almost like an even exchange. You come on my show, please promote whatever you got going on. You got a book, whatever you want to do. Like, I think this is your time.
Yeah. So I actually own 2 companies. I own a company called Upsize and a company called Eurosculpt. Those companies are similar, but different. The procedures are the same. Okay. So this is really a discussion for any doctors or nurses or PAs or whoever who might be listening. Upsize is a franchise business where, first of all, we take physicians only and we help those physicians start penile enlargement practices. We do their advertising for them. We train them how to do the procedure and we give them kind of ongoing support with that. And we try to only have one physician in each city because, right now there's not enough business to have like 9 people in Omaha, Nebraska, for example. And we do have one guy in Omaha. That's why I use that example. So for any physicians that are out there that maybe have other practices but want to get into this and there's not an upsize in your city, which is currently most cities, and most cities there are not an upsize, right? Because we have 14. So if that sounds something you're interested in, then you can contact us. The website, I suppose, will be in the description. So that's all. And there's a link on there where you can contact us to get more information. And then the other company I have is called Eurosculpt, and Eurosculpt is purely a training company, essentially. So this is for any physicians or NPs or PAs or RNs or anyone that, has a license that enables them to do this, to do an injectable procedure. We'll train people how to do that procedure. And so they can contact us. You can put that website in your description as well. And that's called Eurosculpt.com. And for any prospective patients that are listening, you can go to any of those websites to find a doctor or a PA or an NP or whoever near you that'll do the procedure. And what I recommend, whether it's one of our patients or whether you're just generally looking into penile enlargement or really in any medical procedure, no matter what website you go to, get all the information you can, vet the doctor, vet the NP, see how many procedures they've done, get before, after images and stuff like that. And that's how you should make your decision on who to see.
And you're located again in California specifically, right? Like your offices, like if someone definitely wanted to come see you specifically, or are you booked up?
Yeah. So if you want to see me, you can come to San Francisco or Miami. I actually travel between those two places.
Oh, interesting. Okay. Yeah. I'm in South Florida. I'm in Palm Beach.
Oh, yeah. Perfect. Yeah. It's actually not Miami. It's Hallandale Beach in between Miami and Fort Lauderdale. And that's a newer practice, but it's like the original one is San Francisco. And I recently opened that one in the last 4 months. So yeah, either or. And then if you go to the website though, you can see there's other clinics in California, there's New York, there's Texas, Ohio, North Carolina, there's clinics everywhere, Arizona. So if you're a patient that's not in San Francisco or Miami, just click through and find the nearest one near you. And all our doctors are experienced and they've been doing this for a while.
Amazing. Again, Dr. Pash, thank you for such an enlightening conversation, an important conversation, because I think, especially for the men, I know you guys don't feel like you get the front stage camera time that you deserve, especially on issues that I know affect you. Sexual Health Awareness Month, we know the importance of having it and not being shamed or ridiculed or feel like you can't do it. So if a procedure that is available, again, my young guys, 35, 45, you're young, this is your peak, and you're concerned about your size, you're concerned that it's causing you to have inability to have sex, be happy. Again, please look into this. This isn't a joke science thing. No, this is that we have professionals, physicians who do this and who do this very well, and complications are minimal, right? I know you guys love to hear that. Complications are minimal. You don't got to go to an OR room. You could go back to work on your lunch break. So many different positives that if you were even thinking about this, I think this is the time to start looking. And of course, when you got a guy like their Pash, you might as well go to one of our experts here. So again, thank you. Appreciate for joining the Lunch and Learn community and really blessing us with that knowledge today.
Thanks for having me. It was fun.